My name is Gina Damp. I'm one of the pre-lung transplant nurse coordinators, and I will be going over the wait list. You will be listed for transplant through UNOS, which is a nonprofit charitable organization that serves as the organ procurement and transplant network under contract with the federal government. An individualized score will be assigned at the time of active listing for transplant. It determines the priority for receiving a lung transplant when there is a donor available. Calculation is based on medical information such as diagnosis and test results, as well as other attributes. These other attributes are listed on the slide, such as likely survival after 5 years, blood type match, immune system matching, height match, whether or not you were listed prior to the age of 18, whether you are a prior living donor, travel efficiency, and proximity efficiency. Many candidates will have scores between 20 to 25. Sometimes in rare cases, patients may have scores as high as 40 to 45, and this depends on the specific attributes related to their transplant needs. Preparing for the call for transplant. The call is when a coordinator calls you to notify you that you have a potential suitable donor match for transplant. This may happen at any time of the day and night, and you must have your phone with you and on at all times. Calls can come from various area codes, so please do not screen your phone calls. You must answer all of your phone calls when you are listed for transplant, as you do not want to miss a call. Time is critical when contacting a recipient, and if you are unable to be reached, the offer may need to move on to the next recipient who is a match. We may also ask for an alternative phone number in order to reach you, such as a home phone number or one of your support team's phone numbers. You also want to initiate your support team plan. You should be ready to leave your home at the time of the call. The support plan means that you should have your bags packed and that the plan you outlined with the social worker should be initiated. You must have someone drive you to the hospital. At times, patients can be called in as a primary recipient, and there may be a backup recipient also brought in. This means that both patients are a match for the organ. However, the primary recipient is a higher priority. 2 patients are often called in the event that the primary recipient is unwell, unable to receive the organ, and that another person is ready and able to receive the organ at the hospital. When you're called in for transplant, you will report to the emergency department. The time frame in which you will be in the emergency department will vary, and the transplant procedure can be canceled at any time. It is important to know that transplants can be unfortunately called off at any time during this process, whether you're en route or at the hospital and potentially waiting for hours. You are called in advance to make sure that you are at the hospital and ready to receive the organ, and all screening has been performed that's safe for transplant. During this time frame, the donor lungs are still in process of being evaluated. If there is something that is found that is deemed unsafe for transplant, the procedure will be canceled. We recognize that this can be anxiety-provoking time. However, we will always be in communication with you when there is information available to update you. If your procedure does happen to be canceled, please make sure to discuss this with your team while you are at the hospital. What should you have with you during the time that you are called in for transplant? You should have a cell phone, your cell phone charger, and it should be on and with you at all times. You will need a support team member to drive you to the hospital, and the staff at the hospital will direct your support team member on where to wait while the process is happening. You should have an identification card and an insurance card. You should have an accurate and complete medication list and the times of your last doses of receiving your medications. You should have oxygen for travel, not only for travel to the hospital, but in the event that your procedure is canceled and you need to go home. And personal items. Personal items are not necessarily required for when you're called in for transplant. You may want to bring something like a book or a tablet to keep you entertained while this process is going if you have any downtime during the emergency room timeframe. However, most of your belongings can be provided to you by your support team after transplant and when it is appropriate. The role of the support team is to assist with preparing your home for post-transplant. This includes things like making sure your home is clean and making sure you have all of the devices you need ready to go once you're home. Your support team will be involved in your education sessions. These education sessions occur inpatient prior to discharge home or to rehab. These will be done through the inpatient nurse coordinator, social work, nutrition, and pharmacy for medication management. Your support team will need to be present for all these educations, all 3 support team members. Your support team members will live with you post-transplant. One person will need to live in the home with you for however long it is necessary to provide you support with daily tasks and needs, and for any potential emergencies. Your support team will need to provide transportation for you with your post-transplant clinic visits. Clinic visits are weekly post-transplant for however necessary, often for months. You may need to be seen more frequently than weekly, depending on your clinical status. You will not be able to drive yourself after transplant. You will not be able to drive for 3 to 6 months post-transplant. This is because your chest is still healing post-transplant, and we want to avoid any injuries to your chest. Your support team will also maintain communication with the team in the event that you are not able to communicate with the team yourself. You and your support should also engage in support group sessions. Transplant learning is ongoing and lifelong and is applicable to both you and your support team. When you are listed for transplant, your primary care physician and your pulmonologist will still be the main drivers for coordinating your care. The transplant team does not take over any aspect of your care until you are transplanted and they manage your pulmonary needs. Your main contact on the transplant team is your nurse coordinator for coordinating your care. There are various timeframes in which it's important to also contact your nurse coordinator if there are any changes to your condition or changes to your medical plan. Changes in condition includes a hospitalization, a treatment change, receiving a blood transfusion, increase in your supplemental oxygen needs or changes in your oxygen saturation, the inability to exercise or be mobile in your home, any fevers, or any swelling of your extremities. You also want to contact the team for any medication changes to make sure that they are safe to be transplanted, and also any new medical diagnoses such as diabetes or heart conditions. Also notify us if there's changes to your support team. Pre-transplant, your support team is evaluated by a social worker and a plan is in place. Should this change, the social worker will need to reevaluate this new support team member to help provide support. You will also want to let us know if there's any insurance changes or any financial changes. It is important to the safety and success of your transplant to be able to engage in post-transplant screening procedures and medications. Also, please let the transplant team know if you have any travel plans to make sure that we have time to evaluate you when coming in for transplant. Also, notify us of any general clinical questions. For scheduling and appointments, you will contact the pre-transplant administrative coordinator. For any emergencies or off hours in which your physician would like to speak with the transplant team, please have them call the main hospital number and ask for the lung transplant physician on call. If you have any doubts on whether you should call the team, it is likely that you should call the team. Test and follow-up. In-person clinic visits will occur with a nurse practitioner or physician every 2 to 3 months. These visits may occur more frequently if clinically needed. You will also be evaluated by a transplant surgeon in their clinic yearly. All tests will be completed at Brigham and Women's. Outside studies are considered a rare exception, so that your team has all of the information they need readily available to make the best decisions regarding your transplant. These tests will be completed at 2, 3, 4, and 6-month intervals, and also can be more frequent if clinically indicated. These are things like chest CTs, echoes, 6-minute walk tests, and pulmonary function testing, or if needed, heart catheterizations and other procedures. You will receive a waitlist handbook that has a test requirement chart. It's important that you keep track of your testing and fill out this chart whenever you have tests completed. It is an important precursor to the management of a chart that you will receive post-transplant in order to make sure that you are successful with your transplant needs. Patients are responsible for keeping their routine health tests and vaccines up to date. Outdated tests can result in inactivation on the wait list until these tests are updated. Routine health is important for cancer screening purposes and to make sure that you don't have things like infections that may lead to a poor post-transplant outcome. There are varying statuses on the wait list. This includes active, inactive, and potential removal from the wait list. If you are active, this means you can receive a transplant at any time. If you are inactive, this is usually temporary, and this can be due to a change of condition that needs to be further evaluated through testing or consults or labs, through a change in your support team, or at times if a candidate chooses to travel for any reason. Removal from the wait list means that you are no longer a candidate for transplant. Being listed for transplant does not, unfortunately, ensure that you will always be a candidate for transplant. The purpose of ongoing visits and testing is to continuously ensure that you are an appropriate candidate and safe to receive a transplant. It is possible that your condition can change and unfortunately make you too sick to safely receive a transplant. Diet and exercise are very important elements of post-transplant outcome. Pulmonary rehab is a requirement during the pre-transplant process. If you complete your initial rehab class, please check in with your insurance company to see if you are eligible for a maintenance class. We expect that you will be exercising in your home at a minimum of 5 days a week for 30 minutes a day, whether this is walking, using a treadmill, using a stationary bike, or things like light weights. In addition to all your imaging, labs, and testing, you will have ongoing mobility assessments. This includes your every 2 months 6-minute walk test, in which you must be able to walk a minimum of 650 feet with however much oxygen you need. The goal is to go as far as possible and is an indicator of your strength. This will determine your ability to engage in rehab post-transplant and may be the difference between going home or having to go to a rehab. In clinic, you are able to bring your wheelchair into the clinic waiting room after you've completed your tests. However, you will not be able to use your wheelchair in clinic. You will need to walk into your clinic for your vital signs and your appointments. If you are able to meet the minimum mobility requirements, then you will be able to meet this task. You will also have an exercise log in your waitlist handbook. Please fill this out as you're doing your daily exercise. This will include the time of the exercise, how long you exercised for, what type of exercise you are using, what oxygen you are using during that exercise, and what your oxygen saturations are. It's important for monitoring whether or not you have any changes to your condition and want to communicate with the transplant team, but also so that your provider can see any changes in trends. Lastly, nutrition is a very important factor for transplant. Healthy weight and nutritional habits are important to healing post-transplant. Lack of nutrition and low BMI, as well as high BMI, can lead to post-transplant complications and difficulties with performing the surgery. Those at a lower end of the BMI scale must work to increase nutrition to a goal BMI above 18. Those who are at a high BMI or above a BMI of 30 must continuously demonstrate weight loss at each clinic visit. Inability to continuously lose weight to a goal BMI below 30 will result in an activation on the wait list until you have achieved optimal weight loss. The goal is to have a healthy weight for a safe transplant and good post-transplant outcomes. In conclusion, the goal is to work with your coordinator for an ongoing assessment of your transplant status and clinical needs. Active engagement and education and care by the patient and their supports is an important element of the post-transplant process. You must stay active and focus on healthy nutrition. Please reach out to your key contacts in the transplant program for clarification of any questions or concerns.